Imagine walking up to an incubator, pulling out a plate, and knowing exactly what organism you're looking at before you even run a single biochemical test. For a medical lab scientist, the Agar plate isn't just a piece of plastic, it's a storybook. Today, I'm going to teach you how to read it. Welcome to Lab Science Simplified series. When you're a student in the microbiology lab, the sheer variety of bacterial growth can be overwhelming. But identifying colony morphology is the first and most critical step in the diagnostic process. By the end of this video, you will be able to confidently describe size, shape, elevation, margin, and optical properties like a seasoned pro. We're moving beyond just saying it's a white dot to using the precise professional language of the clinical lab. The first thing you notice is the size. In microbiology, we don't just guess, we categorize. Punctiform. These are tiny pinpoint colonies, often less than 1 millimeter. Think of Streptococcus species. Small, medium, and large. Most labs use these relative terms compared to the plate size. Next is the overall shape, or form. Circular, a perfect circle, common in Staphylococci. Irregular. These have no defined symmetry. Filamentous and rhizoid. These look like roots or threads reaching out across the agar. If you see this, you might be looking at certain bacillus species or even fungal growth. Always note the shape first, as it narrows your search immediately. Now, look at the plate from the side. This is elevation. How does the colony sit on the agar? Flat. It looks like a thin film. Raised. It has a distinct edge but a flat top. Convex. A smooth, dome-like shape. This is very common for many enteric bacteria. Umbonate. This has a raised bump in the center, like a nipple. It's a classic characteristic of certain Proteus or Neisseria species. Now, look closely at the edge, the margin. Entire. A smooth, unbroken edge. Undulate. Wavy edges. Lobate. Deep waves or lobes. Erose. Jagged or serrated like a steak knife. Why does this matter? Because the way a colony walks across the agar tells us about its motility and growth patterns. This is where microbiology gets beautiful. Pigmentation is a huge clue. Chromogenesis. Some bacteria produce their own paint. Staphylococcus aureus is famous for its golden yellow hue. Serratia marcescens can produce a striking brick red pigment. Optical properties. Hold the plate up to the light. Is it opaque? You can't see through it. Translucent light passes through, but it's blurry. Or transparent, clear like glass. Texture is also key. Is it mucoid, slimy and wet, common in Klebsiella? Butyrous, creamy like butter? Or dry, friable, crusty, and breaks apart? A mucoid colony often indicates the presence of a capsule, a major virulence factor. You cannot describe morphology without mentioning the media. The agar itself changes the look. Blood agar. Here, we look for hemolysis. Alpha, green bruising. Beta, clear zones. Or gamma, no change. Hemolysis isn't just a color change. It's the bacteria actively destroying red blood cells. MacConkey. This is selective and differential. If the colony is pink, it's a lactose fermenter, like E. coli. If it's colorless tan, it's a non-lactose fermenter, like Salmonella. Always remember, morphology on BAP will look totally different than morphology on MAC. Let's practice. Look at this plate. We see 1. Size. Large, 3 to 4 millimeters. 2. Shape. Circular. 3. Elevation. Convex. 4. Margin. Entire. 5. Color. Metallic green sheen on EMB agar. If you guessed E. coli, you're correct. By following this systematic approach, you take the guesswork out of the lab. If this breakdown helped you feel more confident for your next lab practical, hit that like button and subscribe to MedLab Science Student channel. See you in next video.